Welcome, everyone, to the Illusion of Consensus podcast with myself, Rav Aurora, independent journalist based in Vancouver. And I'm here today with a good friend of mine, Dr. Mike Hart, who's based in Ontario. We were just chatting for like half an hour before we started, and Mike was like, all right, we got to shut up. We can catch up later, and let's start the podcast now. So, Mike, thanks for coming on, man.
Yeah, man. Good to be here. Happy to be on the show. I don't know why it's taken me so long to get here, but finally I'm on.
Yeah. Well, we were evaluating your talent. We were watching you from afar, seeing when you're ready.
Finally made it up to the Rav Aurora. I guess. What should I say? A level.
Yeah. Oh, dude, it's a new dimension here. The Rav Aurora Studios. You started with Rogan, but like we were like, all right, do we let Mike on to the Rav Aurora podcast or the Illusion of Consensus? So we were watching you for a couple of years, and we felt like you're leveling up these days. So we're like, all right, it's time.
All right, well, it's time for me to, I guess, perform on this one. But obviously, I kind of screwed up just then by not having my dings off. Okay,
rookie mistake.
Do not disturb on. Should have
waited another 6 months, man. But
should have, man. Maybe I wouldn't have done that.
Yeah, well, good to have you here. This will be your top line on your LinkedIn page. Talk to Rav Aurora on his podcast, and then Rogan. Rogan number 2. Rav, you put me up there first on your LinkedIn.
Are we going to share what you have on your Bumble profile there, Rav?
Mike and I were just joking. We're back on the dating apps. Definitely don't want to broadcast that too much to the world. But
hang on, I'm not in the dating apps. I'm engaged. Rav's in the dating apps, not me. Just want to make sure I get that out there.
Yeah. Well, yeah. Mike is engaged. Congrats on that, man. That's awesome.
Yeah, man. It's it happened 2 years ago.
Yeah,
but,
yeah. We chatted about it at the time. Yeah. No, we definitely chatted about it at the time. Yeah. Well,
all right. So, what do you want to chat about, brother?
Yeah. Yeah, man. I mean, we can just talk all day long about many, many topics. We're frequently doing phone calls, although it's been a while. Obviously on health, nutrition, overall fitness. But let's, we had chatted over the phone a little bit before this. Let's just kind of start with, you really kind of burst onto the scene with your podcast with Alex Berenson on Joe Rogan, that big cannabis debate you had. It was 2019, is that right?
Yeah, 2019, February 13th.
Yeah, that was well before, I became a journalist in 2020 and kind of got into space, and then I think I DM'd you at some point. But yeah, I was just in high school, and I remember watching that debate, and it was just super, like, for me, I hadn't listened to much of Rogan at that time, like maybe a little bit. And so watching that debate was just so cool. You and Alex and Rogan, like going through data, going back and forth, like, just putting aside the topic, like it was just super cool to see, like, what I'm doing now. I got a fucking podcast mic now. Like, just people can talk and hash things out and disagree, go through data. Like it was such a cool moment for me, watching that full podcast and learning so much, just how to talk and articulate and debate about things. Why don't we just start there for just like a minute or two? What was kind of the impact of that podcast and kind of what it did for you? Was that your first major podcast? And then kind of how did that lead to, kind of where you're at the last couple of years with, COVID, which we'll talk about. And you've just kind of become this, public person, public doctor who, talks about politics and, a lot of politicized medicine issues, which, we'll get into as well. But why don't we start off there?
Cool. So yeah, like with Rogan, and I think people would probably like appreciate this, how it started and why he wanted me on the podcast. So, first of all, like I gotta, it's kind of weird to say this, but I do have to thank, Alex Berenson. And again, I don't dislike Alex. Alex and I have kind of, we didn't really even there was no animosity even at the time during the podcast, but even if there was, like, we've kind of like made up in some ways anyway. And we do agree on, some other topics. I don't think Alex is a bad dude, but he wrote a book called Tell Your Children, which, more or less was like, Reefer Madness 2.0, but just, written in 2019 or 2018, whenever he had written the book. And, the big thing with, that book was a lot of the data that he had was not peer reviewed. And a lot of the data that he had was also too, it was on like teenagers or adolescents and that kind of thing. And, more or less, there was no one who was saying at the time that, THC was going to be harmful to, children or anything like that. So anyways, getting back to the story. So he had written this book. And so Rogan reached out and said, hey, there's this guy who's, kind of spouting some bullshit about cannabis, would you come on the podcast and hash it out with them? And so, that's how it all happened. It was because, Alex had written this book. Yeah. And so,
Nice.
I got on the podcast, and then, it was amazing time there. Like Joe was, super friendly to me. People always ask, I don't think this is like confidential information, but like he had, taken care of, my flight down there and my hotel for 2 nights, which was, pretty amazing.
He does that for everyone. He does that for, that's just kind of his standard.
Yeah. And again, I'm sure he did. I just was the first class, but I did get an exit seat both times. So pretty awesome.
Maybe he's upgraded since then. I know he's like, everyone gets first class now.
Okay, cool. Well, sitting in the exit seat is pretty dope too.
Yeah.
Lots of leg room there. So, and also too, I got like picked up in like a limousine. So someone comes out with like, the thing and picks you up. So that was the first time, that have ever happened in my life. So, and it's actually the only time I've ever been to California. So he was still in the California studio at the time. Yeah. So that was kind of cool. I mean, I thought the debate went, really well overall. I know he's had Alex back on a couple times. He hasn't had me back on yet, but hopefully that'll happen sometime in the future. But I mean, is there anything else you want to know, I guess, about the pod?
No, well, I mean, I think that podcast was big for you and Alex. And Alex, since then, I mean, he's just become the superstar, suing the Biden administration. He's got one of the biggest fucking Substacks that's doing really, really well. Massive readership there. With all the stuff he's been doing, reporting on vaccine side effects, he's become such an enormous force for good, I think. And I've really, looked up to a lot of the stuff he said on COVID. And obviously, I was going to say earlier, it was kind of ironic that Rogan reached out to you to, debunk or address quote unquote bullshit that he was spewing. But now, him and Rogan, like he's like Rogan really likes, what he's doing and, should because of his efforts against the Biden administration and exposing the censorship industrial complex. So he's really, his career's really taken off the last couple of years, which I'm really happy to see. I think he's been on like 4 times since your podcast. He's kind of on a yearly basis. He told me last year when we met at a Substack dinner. But I'm sure you'll get on too. I know you and I've chatted before. I think you said you were waiting to kind of have your own project or something to go on for because Rogan's just fucking hammered. I'm assuming with just everyone, all the comedians, authors, scientists,
MMA guys,
doctors, MMA guys, musicians, fucking Miley Cyrus, fucking Snoop Dogg. I mean, everyone wants to come on, right? So, I'm sure you'll get on there, man, when you're ready and when you have something to talk about, as you told me, right?
Yeah. Hopefully, it happens again at some time, but if it doesn't, that's okay too. I got my own podcast going on now, and I kind of like coming on podcasts like this, so I'll figure it out.
Yeah. So my question was like, how did that kind of lead into you being this public voice? I mean, we can get into COVID too. That's kind of a big thing people are still interested in. You've been very vocal over the last few years. I mean, 2 things like on social media, you're posting a lot of good stuff, different studies on nutrition. You've posted stuff on like exercise, having like antidepressant effects, like just one random thing I remember of yours. Like you're always like seeing new stuff on PubMed and posting that, which is awesome. But you've also been very vocal on the COVID regime in Canada, which is just fucking insane. What we went through as a country, right? So I think those have been pretty big topics for you. Yeah,
I mean, you kind of we're talking about something today. Actually, I think you said before the show, like you wanted to ask me about that tweet that I had out today or yesterday about how like there was a new study that came out in JAMA that showed that the trust in public health decreased from, I think it was 71.5% in April of 2020 to 40.1% in of January of 2024. So, I mean, that's insane, right? Like
Yeah.
it's almost like half, which is completely wild. And it's also like, so only 4 out of 7 people, like less than 1 out of 2 people now, trust public health or trust their physician or trust, hospitals kind of thing. So, we need to do a better job, obviously, of, fixing that up. And it's going to take a lot of effort. But the thing is like, we can't keep digging our heels in. Like, I don't even know if we've started the, repairing process yet. Like, it seems like we're kind of still, digging things in and making things worse in some ways. Like, I don't, like, if someone's were to ask me, what do you think the public trust is going to be in, say January 2025 or January 2026? Like,
yeah, maybe lower.
I mean, right now, it's probably going to be lower. Like, why would I think that it's going to be higher? Like if it's been going down so steadily and nothing's really changing, then why would I think that, it's suddenly gonna stop, right? So I think that's a real big issue.
That's a great topic for us to discuss. I mentioned to you before that new statistic everyone's talking about on Twitter today, or X. What do you like? COVID pandemic was a big awakening for many people, including myself, including yourself. Obviously, you and I are in very different positions. I'm, from the outside in many ways as a journalist and podcaster. You're also a podcaster, but you're also a doctor. You're also an MD. You have your own clinic. Is it, by the way, is it public or a private practice? Well, we're in Canada, right? So public.
Yeah. So it's all public. Yeah. I think
there is no private here.
But that is I mean, again, there's so many good topics to talk about, but just quick on that, like even right now, there's a lot of doctors who are trying to make, private care unavailable now. They're trying to basically form, some kind of, statement to put together to the government and try to make private healthcare, illegal, essentially, from my understanding. Right. And there's a lot of people that are upset about that. And I know that in Quebec, it has become more private. And so I don't know everything about this, but that is kind of becoming a hot topic now in Canada.
Yeah, I was under the impression that we don't have any private; that's all public. My dentist was recently telling me something like that you can't do private clinics here.
Yeah, I think it does change a little bit by province, and it's something that I probably should know a little bit more about. But for the most part, it's mostly just socialized public medicine in Canada. Like, it's very difficult to get anything done that's where you can pay for it, privately.
So, COVID pandemic, and you mentioned the loss of trust. Let's spend a few minutes there.
Sure.
I mean, there's just so much to talk about. I don't even know where to start with that. But for you, being a doctor, seeing what happened, in real time, what's your kind of like looking back at the pandemic period? Anything that sticks out to you in terms of just like being a doctor and seeing the authorities fail so drastically, whether it's the Trudeau's office, whether it's the various provincial authorities, local authorities with the mask mandates, vaccine mandates. I mean, such a difficult time and so much misinformation being spread by people in elite institutions, in government agencies, right? Who you would think would want to help you and, arguably do want to help you. Although people can debate intentions and motives, but just giving just really fucked up advice on masks, vaccines, lockdowns, school closures. I mean, it was all so atrocious.
Yeah. I mean, there's a lot to talk about there. So, my thing with like the vaccines, like I'm not, anti-vaccine, the way that I just kind of like to tell the story sort of like what happened and then, let people decide. But I mean, essentially, the virus came, obviously we didn't have the vaccine when the virus came. Then, the vaccine was quickly put together, which we all know, and then it was put out into the public. And so what happened? initially, most people who did receive the vaccine, there was a period of time where it seemed like they were less likely to become hospitalized and die. If you looked at a lot of the statistics for, say, in the period of 2021 and, when it was launched like early 2021 in most parts of the world, up until, say, mid to, say mid 2022 even, and I may be being a little bit too generous there. But in that time period, it did seem like there was more unvaccinated people in the hospital, proportionately compared to vaccinated people. But then, natural immunity happened. And I think, again, that happened sometime, in early 2020. Everyone almost had, natural immunity at that point, early to, mid 2022. And then at that point, it just seemed like they still didn't make any adjustments, despite the fact that there were so many people out there with natural immunity at this point.
They started doubling down and have the new boosters, both Canada and the US. I reported on a bit of that.
And that kind of thing. Yeah. So, that to me, was probably caused a lot of distrust in a lot of people. Because if you're a healthy person, you've already had COVID, you recovered from COVID, you're 30 years old, you're young, healthy, you're not on any medicines, to mandate someone to get a vaccine when they've already developed natural immunity, they're already healthy. I don't think there's any science for that. I don't think there's really good reason for that.
Not at all.
Did I think that at some, and again, I have to go back and look at the data, but it seems like in 2021, maybe early in 2022, there was a disproportionate number of people in the hospital who were unvaccinated compared to the vaccinated. So I do think it may have helped early on.
Yeah.
But once people had natural immunity, I think that we really, really should have, changed course. And I don't agree with, mandating things just based upon ethics. I don't think that, things should be mandated. And the other part, when people say, okay, well, it's not mandated. Well, if you can't go to work and you can't travel and you can't, go into a restaurant, I mean, that's basically forcing
go to a gym.
Someone, right?
Yeah.
Can't go to a gym, it's basically, forcing someone to get it, in my opinion. So I think that, that's kind of mistake number one, and maybe even more importantly than that, they made a mistake and they've still, even to this day, really are doubling down on it, and I think that's what's causing a lot of the distrust in the public because, you want to be able to trust people. You want to understand that, okay, if this person makes a mistake, they're going to correct themselves. That's someone that, okay, I know I can trust this person. But if someone's going to make a mistake, and then even if they know they made a mistake, they continue to, spread that lie, that's someone that you shouldn't trust because that they're not telling the truth. It's okay to make a mistake, but it's not okay to, make a mistake, find out that, you were wrong and then not,
correct.
Make up for it and not course correct. Absolutely.
Yeah. I want to make one point. You mentioned there seemed to be a disparity in unvaccinated versus vaccinated for severe outcomes with COVID. That data is severely confounded. And this is, Alex Berenson really brought this, to my attention in his reporting. Dr. Vinay Prasad, Dr. Tracy Beth Hogue, they also wrote a lot about this, the phenomenon of healthy vaccine bias, right? So people who are healthy tend to get vaccinated at much higher rates, and people who are unvaccinated or not getting various vaccines tend to have higher rates of obesity, smoking, addiction, cancers, etc. So you're naturally going to have a bit of a skew anyways. So to tease that out, it's very hard to do.
No, I could definitely see that though, because unfortunately, just with lower socioeconomic people, they are more predisposed to poor diet, smoking, alcoholism, substance abuse. Unfortunately, you kind of name it, being in a low economic socio status is affiliated with really poor health outcomes and really poor health behaviors. And so, I could easily see, why that data could be true.
Yeah, so that heavily contributed to, I think, the disproportionate data there. So to me it's really not clear. I mean, at best you could make a case for 2021 elderly people pre-infection, or people with multiple comorbidities pre-infection. There might be some benefit there, but other than that, the data gets really, really difficult. And then you add vaccine side effects. You add in that paper by Joseph Freeman, who we've had on the show multiple times, the 1 in 800 serious adverse event rate associated with the COVID vaccines from Pfizer and Moderna's data. That was the big. I'm sure you saw that at the time. That was the big paper. Freeman.
Yeah, I mean, 1 in 800 isn't small. That's for sure. I mean,
it's much different than other vaccines are like 1 in a million, 1 in 10 million, 1 in 800. If that's true, is insane.
Yeah, I mean, that's I remember actually having conversations about this, and probably some of it was with you, Rav, about what the acceptability of the adverse events was of former vaccines or previous vaccines as opposed to the COVID vaccine. And I don't remember a little bit like the exact number, but I do think it was something like 1 in 10,000 or even more, like 1 in 100,000 or 1 in a million, like something. Something
for other
very,
vaccines,
very high.
Yeah, for other vaccines, usually like 1 in a million. That's the flu vaccine, although some people are even questioning that now. But other vaccines too, 1 in 100,000. So suddenly 1 in 800. You could gamble all day long, money on not being the 1 in 800, obviously. But if you're unleashing this thing to the population, suddenly 1 in 800 is big compared to 1 in 100,000, right?
Yeah, big time. And you do need to put all that like into perspective and take it into account when you're getting the vaccine. And then that kind of brings us up to the point of informed consent, and how many people were told before they got the vaccine that they had a 1 in an 800 chance of having an adverse event, and would that information have changed whether or not they got the vaccine, right?
Yeah, or the emerging data, not currently emerging, although I'm sure there's more stuff being researched, but stuff that emerged later in 2022 and 2023 on myocarditis, severe cardiac outcomes, some people dying from the vaccine from severe cardiac outcomes. There's studies from South Korea and Hong Kong, looking at some of these things. Definitely informed consent was violated, I think. And for you in your clinic, did you see any vaccine injuries, people who had vaccine issues, or anecdotally in your circles?
Yeah, I mean, it's kind of, one of those things where, a lot of doctors were just completely afraid to report any vaccine injuries. That's really the reality of it, is that people were really afraid to report any vaccine injuries.
You saw that?
People,
people like that?
Yeah, for sure. And also really? Too, like patients would tell me that, like, I think this is from the vaccine. And, for me, for me to write that down and send it to like a specialist or something, like I know it would just be like dismissed. You know what I mean? So it's hard, I think, for people to report it to anyone, because most people, well, not most, but a lot of physicians, or some physicians, are going to, immediately just think, this person's kind of crazy right away. And then some people who may even believe this, person are just like too afraid to report it to anyone, which is really unfortunate.
Right. So you actually had people come in who might have been vaccine injured, and you didn't really treat it as such, or send them to various specialists because you thought it wouldn't get anywhere?
Well, people would come in and say, I think this has happened, from the vaccine. And, I would say to them, okay, like, let's like investigate it. Like, it may be something to do with, say, like, women having a change in their menstrual cycle.
Right. That's very common.
And so,
super common.
Right. And so, I would make maybe a referral, send it to gynae, and, I may do a pelvic ultrasound, do some blood work on them, whatever, I could kind of do on my end. But if I send it to the gynecologist, I'm not saying that, they're going to dismiss it for sure. But if I write on, which I do, write that, like, this patient believes that it happened from, having the vaccine on this date. I don't know, how, serious the specialist or the other physician will take it, so I don't know how, like how many of these are being reported. I don't know how many people are really
Yeah.
being dismissed. And I find that even if someone does want to, report it or does believe them, they're worried about documenting it in their notes, just because, you know, uh, even documenting that I think could lead to trouble. Everyone's basically just scared to death to say anything, and like Joe Rogan said that when he was on, Jordan Peterson said that when he was on Joe Rogan there like last week. He said the Canadian physicians are afraid to say anything, and he's absolutely right. They are.
Yeah. Oh, so you're not saying you weren't taking it seriously, like when you had patients come in with potential
No, no,
vaccine
no, no.
injuries?
I'm saying I was
Yeah.
taking it. I was taking it seriously when I have patients come in. Like I'm not saying that I don't
Yeah.
believe them. I think
Yeah.
I do believe them. But a lot of them, for instance, want to be referred to like a neurologist. Which would be probably by far, like not by far, but one of the more common, specialties that people would like to be referred to for this kind of thing. And I'm just saying that I don't know if I make referral to someone and I put on it,
Yeah.
this person's had this person's reporting that they have a vaccine injury, how likely, a specialist or someone else may take that. And then the other part of that is like, if someone does have a vaccine injury, how do you treat that is, very, very
Yeah.
complicated. And it's not an
Yeah.
area that's in my specialty, like at all,
Yeah. Yeah. Was it ever confirmed in your clinical practice for individuals who had vaccine injuries, or very, very likely, but maybe not fully confirmed?
I mean, you can never really, confirm these things. So I can't say like, yeah, I had a confirmed case,
Yeah.
and even if I did, I'd probably be afraid to even say it. But
Yeah.
I think there are, confirmed cases, obviously, of people having,
Yeah.
vaccine injuries, or it wouldn't be a 1 in an
Yeah.
800 rate, right?
Yeah. So you're saying you'd be afraid to to say if you have likely cases of vaccine injuries at your clinic?
I mean, I would be, yeah. I mean, for sure. Like if, like I'm not saying that I wouldn't, write it down, but when I do write it down, it's not like this is a vaccine injury. It's like patient reports that since getting the vaccine, they are experiencing these symptoms. And
Right.
so I don't know if that's like saying a vaccine injury or not, or I'm just kind of like reporting, what they're saying. And that's kind of
Right.
basically like as far as I'll go. Like I won't ever call anything like a vaccine injury because, it's just too scary to.
Right. Right. But you definitely saw people in your clinic that were, you'd say most likely vaccine injury. If you had to bet money, it seemed like it was from the vaccine.
If I had, I mean, 1 in 800, I see, 200 people a week. So,
Yeah.
obviously I've seen people who have had,
Yeah.
vaccine injuries, whether they've been, reported or not. Right.
Did you see any myocarditis or cardiac symptoms?
I've had, a couple people that, again, reported it. Again, a lot of the times if someone has myocarditis, I send them off to, the cardiologist. And
Cardiologist.
so,
Yeah.
yeah. And so they usually, deal with that issue. Like, I am a general practitioner, right? I'm a family doc. So like a lot of these vaccine injuries generally aren't related to something that a family doctor would treat. So like myocarditis is probably one of the bigger ones. Something neurological is probably, one of the bigger ones, like dizziness or paralysis or Guillain-Barré, one of these things. That's more like neurology area. We talked a little bit about menstrual cycles. Obviously, that's more of a gynecologist and obstetrics area, or gyne area, not obstetrics. But so, a lot of the injuries that people are reporting are not really something that like I
Yeah.
would treat anyway. So like,
Yeah. Yeah.
I've never
Yeah.
treated like a vaccine injury per se.
Hi, everyone. A quick recommendation. I just saw a great film on YouTube called Medicating Normal. It's about the growing trend to medicate mental distress with powerful psychiatric drugs like Prozac, Xanax, Seroquel, and Adderall. For some people, once on these drugs, they're almost impossible to get off, and they have devastating side effects. The film tells the story of people whose lives were ruined by taking these common prescriptions. Watch a trailer and the award-winning film on medicatingnormal.com. That's medicating normal, medicating with an ing at the end, normal.com. Our show notes and newsletter will have information on how to find the film. There's also a YouTube channel. Don't miss it. Check out the link in the description below. Thanks. And you being on the inside, let's spend a couple minutes talking about the way that healthcare is run, the way doctors are governed and organized, and the bodies that govern you guys and give you your guidelines and dictates and what you can do and what you can't do. I think a lot of people are curious and interested. Certainly, I am, to dig into that more. Of like, just find out more and more, investigate more and more of what's happening behind the scenes. I mean, can you kind of talk a bit about that? Of like, I'm sure there's definitely issues, and you and I have talked privately about a couple things for sure. But issues with the way in which these agencies and these governing bodies work, and how they have to enforce conformity, and you can't violate the guidelines. You can't recommend it. You can't recommend supplements or certain herbal compounds outside of guidelines. Like, can you talk about those kind of dynamics that were obviously very much highlighted throughout the pandemic?
Yeah, for sure. So, I mean, when you're trained through medical school and you go through residency, you're more or less supposed to follow, clinical guidelines. And clinical guidelines in many instances are very, very helpful. Like if someone has like a sore throat or, some kind of infectious disease, there's lots of guidelines you can look up, or you can see like the first line antibiotic, second line antibiotic, and, those kinds of things. They're extremely helpful. And you want to make sure that you develop something where, people are getting essentially the best medicine for their condition every single time. I guess the issue becomes with guidelines is that, sometimes they don't get updated, very, very quickly. And, sometimes the guidelines could be, improved. The guidelines are not necessarily always say for optimization of health, which is what a lot of people are looking for these days. And so,
Yep.
Guidelines can be helpful, but they also can be challenging to work with because, again, they don't get updated. They can be a little bit outdated, and they kind of restrict, what you should and shouldn't do with a particular, person. And, I'm not saying all the guidelines are bad. Some of the guidelines are fantastic, but there is, that issue of, sort of like, sticking to the guidelines. So I think that's kind of like number one anyway. And then in terms of, online, like what we can say, I do think there is a lot of restriction. If there wasn't, Jordan Peterson wouldn't be making comments like he made on the Joe Rogan podcast. It's my firm belief that most physicians would, I really believe, would think that males should not compete against females. I don't think most physicians would agree with the statement that men can get pregnant. I don't think most physicians agree with there being tampons in, the bathrooms of like, adolescent boys.
Yeah, at my sister's school now. At the middle school I went to, grade 6 to 8, they have that there now.
So like, I think that I mean, that's crazy. So like, the thing is, if you're against that, or if you think that that shouldn't be the case, you're not allowed to voice your opinion. But if you are with all those things, you can voice your opinion. Like, that's perfectly fine. Right. So, if you're a doctor on the left, I mean, you can pretty much say, kind of whatever, I want to say whatever you want, but pretty close to it. Like, you're going to get away with a lot more.
Right.
Right.
Trans lives matter. Men can become women,
yeah. Like if I was applying for medical school, I would absolutely put pronouns in my bio. I mean, there's I wouldn't, even think about not doing that if you want to get in, if it bothers you too much to do that and you don't want to go to medical school, I totally get that too. But I'm just saying, if you really want to get in, like that's what I would do.
You're saying for pragmatic reasons.
Yeah. Just for pragmatic reasons. And yeah, so, I mean, I think that the issue is that the people who are online and, saying all these things and are, saying that men can get pregnant and this kind of stuff. They have no one who's coming up against them or pushing back against them. Like, they're just allowed to say whatever they want. And if anyone else says anything, like, they're done, so there's no dialogue going on, and it's pretty awful, and like,
right.
Yeah.
Right. Yeah. And it's crazy. Like, you're saying that you could be punished. Like, if I'm sure the audience can intuit this, but if you were a doctor in your area or really anywhere in Canada and said that, take a line from Joe Rogan, which was completely vindicated, but he was attacked for, if you're a young, healthy 20-year-old, you don't need the vaccine, right? If you tweeted that out, I mean, is that a punishable offense or something that would, come on on people's radars?
Yeah. If you said that, you would automatically lose a license.
But you were saying some very sensible stuff on vax. Like, how did you thread that needle? Because you would constantly study, tweet out studies. I guess, were you careful to like make sure it's like fully cited or something, or only quote from papers? Because you would criticize the vaccine policy. I remember.
Yeah, I mean, I was just very, very careful. I like, anytime I said anything, I always made sure I had a study to basically back up what I was saying, and I never like implicitly, it's not really my job to tell people to get the vaccine or to not get the vaccine. I think it's my job just to share the best information possible and then to figure out themselves. And I don't think that, public health did a very good job of telling the whole story. Like, it seems like they only, kind of talked about the studies that fit their narrative, when, what you really should be doing as a scientist is just looking at the raw data, putting out the raw data, digesting it, and making it, easable for other people to digest and understand. But you shouldn't be, mandating things, in my opinion. It's not the way medicine is supposed to be done.
Are you against any kind of vaccine mandates? Because there are some like schools that mandate other kinds of childhood vaccines.
Yeah, I'll be honest, like, I'm not an expert on vaccines, and I haven't, done a deep dive into the childhood vaccines. There's just so much out there. There's so, it's hard to be an expert on everything. So I just, I don't know the data on childhood vaccines, which, right, again, I should, but I don't know the data on childhood vaccines.
Yeah. But you were saying earlier, like, if you had tweeted out, young, healthy people under 25 don't need the vaccine, you think you would have lost your license for that?
Yeah, for sure.
Yeah. That's so fucking crazy, man. That's so, like, this is just that's if what you're saying is true, which I think it is, that's a de facto, I mean, forget de facto, that's just a censorship regime. You just have to fall in line. You got to conform. You can't step outside. Like, that is just so censorious, dictatorial, totalitarian. Like, that's not free speech. That's not, let's have a debate, let's have a discussion. That's censorship.
Yeah, like, I don't want to win a debate. I just want to, like, make sure that the best information gets out there and that people are making the best, like, most informed decisions for them. Like there's just, we should all just be trying to tell the both sides of the story, or the whole story. It shouldn't be, just one side. There shouldn't be just one narrative. People shouldn't be, confirmation bias, like just looking to, confirm what you already think is true. You should be trying to look at studies that, are completely against what you actually think, and then maybe try and figure it out. That's the way to do it. You don't just, pick one side, go with that, and then don't talk to anybody else. You should be talking to other physicians. You should be having open dialogues, and, people should be able to, speak their mind and have a reasonable opinion without having this fear of losing their license.
Yeah. And let's like talk a little bit about, like, in general, the way in which the public health authorities just fucking failed at that time. Like, there was no clinical recommendation for vitamin D, exercise, sunlight, having a healthy diet. It was vaccine, mask, lockdown, follow us. We're the science. Other people are anti-science kooks. Like, that was just insane seeing that happen. And, not enough doctors saying take your vitamin D, get X amount of exercise a week.
Yeah, I mean, I think there's a lot of things that we could have done to have, prevented people from getting, sick from COVID. And like you said, like the exercise is, critically important. I actually saw something recently, and I put it out, I think, on my Twitter and my Instagram, saying that, that forget the exact measurement they have of your cardio respiratory capacity that they use in the study, but it was like for every 1 mil of increase in your cardiorespiratory fitness led to significant improvements in COVID outcome. So like any kind of improvement in your cardiorespiratory fitness would improve COVID outcomes, right? And none of that was discussed. And then there was a crazy study that I posted actually maybe 2 to 3 months ago on Spiralina. And I forget the exact numbers, but it was something like, in one group of the study, like 17 or 15 people died that in the placebo group. And then in the Spiralina group, no one died, like 0 people. Like it was staggering.
This is treatment for COVID?
Yeah, treatment for COVID.
Yeah.
And this is the most important point that I should have mentioned. These were all ICU patients. So these were hospitalized ICU patients, like they were sick, right? Super, super sick. And they came back with this treatment, right? So,
wow, that's crazy.
Incredible. Yeah. And then there was also 2, meta-analysis of randomized control trials on curcumin, like fairly early in the in the pandemic. Like I think they came out in like 2021, 2022. Like it was early-ish, not like very like at the very start, but because we did need time to accumulate data. But still, like even at that time too, like if you're not able to accumulate data and do randomized controlled trials, like I do think that if it's like a gigantic pandemic that's affecting everyone, like why not like use like mechanistic studies, like hey, like when you put this in a dish, like it kills this virus, or like it at least does something to like decrease the replication. Like why don't we use maybe things that we haven't tried out in humans, but we know that when you give them to humans, they're completely benign and maybe they'll work for COVID. I think that's reasonable.
Yeah.
But there are other things like the beta histidine or like the povidone iodine mouthwashes. Those have RCTs on them too. I think those are fantastic. I get patients even if they have a sore throat, like not related to COVID, to use those. Those are great. But yeah, the vitamin D, sleep, we didn't mention. Sleep is massive. If you don't get enough sleep at night, your immune system goes to shit. So you really need to ensure that you're trying to get a lot of sleep. Good nutrition too. Ultra processed foods are linked to lower immunity. Having hyperglycemia or high blood sugar, that's also linked to lower immunity. So like all these things that I'm mentioning are things that people can control, right? Like vitamin D, supplements like spirulina or curcumin, getting exercise. I didn't mention sunlight, getting sleep, all these things, outside of the supplements too are free, and so, it's crazy how we didn't have this discussion, because it would have made such a tremendous impact on the outcomes of so many people.
Yeah. And you mentioned this spirulina. That's I've taken a supplement before for like digestive purposes. It's like some kind of green plant. Is that right?
Yeah. Yeah. Chlorella, like I'm not really sure what the like, I can't get into too much more of like the exact, compounds in it that are certainly potent, but I know in the studies, that they gave to humans, again, in ICU patients, it's dramatically improved overall outcomes.
Yeah. That's crazy.
But I think it has something to do with like inhibiting the cytokine storm somewhere, like decreasing inflammation.
Yeah. Yeah. So yeah, that's crazy. So that if we had known that earlier, I mean, you said this study only came out a few months ago anyway, so we didn't really know the spirulina.
The spirulina one did only come out a few months ago, but I've taken spirulina for almost a decade, just because I think it's incredibly nutritious. So I just included it in my daily supplement regimen. But
for what purpose do you use it?
So there's some studies that show that basically for cardiovascular purposes, and it's not like incredibly strong, like in all these, different, clinical parameters. But literally, if you look up almost anything like lipids, if you look up C-reactive PCR protein, which is, linked to cardiovascular disease, blood pressure, like all these things, even for obese people, it can lead to weight loss. So literally almost anything, LDL oxidation. So literally like any like thing that you can almost think of in terms of like reducing like a cardiovascular parameter, it's been like associated with doing so. And it's one of the very, very few things, like I'm not sure again if there's like, evidence that shows that this has like dramatically like improved like clinical outcomes in humans, but I know that it does help with detoxifying heavy metals from your body. Like if you take a little bit of spirulina, like it can even help remove like arsenic, which is kind of cool.
And you're saying that for the COVID pandemic, like should that have been investigated earlier or potentially recommended? But you're saying the study only came out a few months ago, so we wouldn't have known.
Yeah. So what I'm saying is I think that like, some of the things I mentioned, like the vitamin D and some other things that say we're good for like, upper respiratory tract viruses or just like the common cold. I think some of those things could have been implemented probably a little bit earlier, just based upon the fact that they work for the common cold and based upon like of like mechanistic or animal studies that may have been done. But I do think, again, like I don't know the exact dates, but I do think even curcumin in 2021 did have some data. I think that vitamin D we know has like a lot of data for influenza or the flu, and so we would have assumed that it would have had some impact there. That could have been recommended. I think the povidone iodine stuff was pretty early. I think that was 2021ish. So I think there was some treatments that came out, like maybe not right away, but some that came out in 2021, and then we could have used some of the logic and the things that we knew that were effective for the flu and had that implemented. Again, completely benign things and things that you should be doing anyway, right?
Yeah, I mean, and just the vitamin D example, right? There was so many studies showing data points of people in the ICU suffering from COVID, like 70 to 80% of them were deficient in vitamin D. I think some even estimates were higher. Why the fuck did not BC government of Ontario, the Trudeau government, why did they not just ship vitamin D to everyone, recommend like, go get vitamin D. Here are the dosages per individual. Take this many IUDs. Like that was never part of the conversation. Instead, it was take this experimental vaccine that was pushed under EUA, deliberately, cut corners. It was done in a very fast, way, and it ended up having a lot of side effects too. It didn't have to end up having side effects. I mean, some things you could do quickly and maybe you get lucky or, not as dangerous, but it ended up having a lot of side effects, particularly for my demographic. And yet no discussion of vitamin D and exercise and sleep and, let alone curcumin and some of these natural supplements, right? Like that's infuriating. And that's why we're now at 40% trust in the public health.
Yeah. And like I said too, unfortunately at the beginning of the show, like I don't really see anything like changing. Like why should I believe that in 2025 or in 2026 that number is going to be higher? Like I don't really see why. Like give me a reason why, And so I'm not really sure what the solution is there. Like we can certainly discuss it, but when it's dropped from 70% to 40%, like that's difficult to come back from. It's not going to happen overnight.
Yeah, for sure. And what do you?
And I think it's harder too to gain trust than it is to lose it. Like you can lose it very easily, but to gain it back,
right?
That's hard.
Yeah. I know you got to go in a couple minutes here. Two things. Like one with the like Ontario College of Physicians, like wherever pick your province. Like why didn't they act better? And like why didn't you get an email saying tell all your patients to take vitamin D? Tell them to exercise this much and do this. And there's some data coming out that curcumin and these supplements could maybe help them. Why didn't they do stuff like that? Why did, BC Health and the Trudeau, people running the national public health bureaucracies, why didn't they do any of this? Do you have any hypotheses or theories?
I mean, I think it's just slow. A lot of it is just slow, but I mean, you can like, as much as I don't like Trudeau, the US government didn't do it. I don't think any other government did it that I'm aware of. Maybe, they have, but I can't remember other, governments like shipping out like vitamin D kits or, curcumin kits or, even mentioning some of the things that we mentioned, like, try to get more sleep, try to exercise. Like,
Mm-hmm.
I didn't see much of that really being, put out, not just by, the Canadian government, but by any government at all.
Right. Interesting. Yeah, I mean, I know Scandinavian countries did better in terms of like lockdowns, right, and
Way
not having
better.
not having
Yeah.
as many mandates. I mean, Canada was uniquely bad with mandates, so there was that.
Yeah.
But yeah, I mean, vitamin D, we kind of knew early on, like, like I feel like the authorities governing, people like you and physicians in your area should have done way better than they did.
I mean, I think that, there was just no effort at all. And that's where we really failed. There was just no effort for any kind of like, treatment. And evidence has come out that there could have been, some kind of treatment, like some kind of recommendations to help prevent or reduce, the severity of this disease. And that's where we really failed. And I think that's where a lot of the distrust does come from. Like you said, I think it does come from like a lot of people are upset about, some of the issues with the vaccines and certainly the vaccine mandates. But I also think too, people are upset about this issue. Like they know that they could have, said some statements and put out just some really simple recommendations that could have made a dramatic difference, and they didn't.
Yeah.
And I don't know why they didn't, but it's crazy that they didn't, and it cost a lot of people their lives.
Yeah. You mentioned that you don't see any easy solution. I think I disagree with that. If you, I think you'll probably end up agreeing with me, but like for me, it's very conceivable to see, BC Public Health, Ontario Public Health, just being overhauled, and there being new leadership like even post COVID that recommends vitamin D and has better strong protocols for exercise and sleep and various kinds of herbal supplements and mental health things, different therapies. Like I could see there being much better public health. Like have someone like Jay Bhattacharya run the CDC, or have who was it?
Yeah, I mean, it could happen if Jay was to run it, but I just don't think that he's going to be in that position. I don't think they're.
He might be. He might be.
Oh yeah.
I don't know what is out there or not. I'm just saying hypothetically. Let's say Trump gets in office.
What is out there? I'm going to Google it right now, but you keep going.
I'm just no. There's nothing out there. I'm just saying.
Okay.
There's no news right now. I'm just saying, like,
okay.
if Trump were to get in the United States, he's not going to appoint fucking Eric Topol or Peter Hotez. He's going to, Jay Bhattacharya might be one of the guys, or Martin Koldorf or Tracy Beth Hogue might be one of the CDC, the heads of the CDC, instead of the clowns that are running the show right now. So, and it's conceivable that, Jay, maybe bird flu comes or another pandemic comes, which there will be one, that someone like Jay running the agency, or Martin Koldorf or Tracy, they would not be doing what shitheads like Rochelle Walensky did.
Well, I know it's like almost a bit of like a dream in some ways, but I was hoping he was gonna, point like Robert Kennedy Jr. as the VP, and if he does get in, he can still have Robert Kennedy as like the Surgeon General maybe, or something like that. Like he could, give him some kind of position where he could have some kind of power and he could, do something, because I think Trump, it seems like he does want to make a difference. Like he says, he's, wants to make a difference for, people's lives, and he wants to look into, pharmaceutical companies and stuff like that. Like Callie Means posted that. I actually retweeted it. It was pretty awesome for, to hear him say that.
Sorry, Trump
is he
said
doing
what?
it for both? He kind of said, like, he wants to look into, he wants to look into the pharmaceutical companies, and he wants to look into the food industry, and he wants to kind of know like what's going on, And so I think that was great. Yeah. Callie Means had put it out on his Twitter because he had did it at some like rally or something. He had suggested it. But I mean, that's really interesting. But I do think that, Kennedy knows a lot more about the science, and he would, probably do a better overall job with it. But, we'll see what happens,
I know you got to go in a couple minutes. Is there anything you want to say in terms of like reforms that you could see in place with, let's say that the governing body of physicians in your area, or even higher up. I mean, I'm sure that might be very easy to say, like, don't punish people for dissenting on trans, like that'd be easy. Or any political views, like allow doctors who are conservative, liberal, and libertarian to say what they want, like that'd be nice.
I mean, I think that we should have more, free speech. That's what I think. I think that we should have more, free speech, but, there's really not, I don't have really as much like maybe hope for change as you do. So what I really just tell people is
I'm 23. Apparently I'm uniquely disposed towards giving people hope on things.
I just kind of think that
step aside,
the
Dad.
best thing for you to do.
Step aside, Dad.
The best thing for you to do is to focus on yourself and to focus on your own health, because don't put your health in the hands of others. Don't let your health get to a point where you need to put your health in the hands of others. Right. And obviously sometimes you're going to get there and that's all you can do. But if you can do whatever you can to prevent yourself from getting there, like focus on preventative health, because I don't think, the government's come to save you. I think that you gotta focus on your health and figure it out yourself. And so that would kind of be, my message.
And not to sound too sinister here, but even your family doctor. I mean, my family doctor, who probably has no idea what I do, never listen to this. Although if he does, hey, but like he just, they're just not, they're not doing what you're doing. They don't have a holistic perspective, a preventative perspective. Their perspective is very much, not to sound too sinister here, but even your family doctor. I mean, my family doctor is never going to hear this. If he is, hi. But like, it's just like, my experiences with, conventional mainstream doctors and many of my friends too, like they don't have like a holistic preventative perspective. They're never going to, tell you to take magnesium or ashwagandha or lion's mane mushrooms, or, I've struggled with a lot of digestive stuff, a lot of anxiety related stuff, and all the things that I found to work for my particular, often very psychosomatic issues, just, anxiety, nervous system dysregulation, like working through that, like, meditation, sleeping earlier, ashwagandha, magnesium, even like stuff like affirmations and like really doing things. I've done a number of podcasts with Dr. Narina Ramlakan, who you might like to have on your podcast. And she, helps people sleep better. And for her, the key is, regulating the nervous system and doing things to better enter the parasympathetic state. And there's all this emerging science and research now of like things that do that, like whether it's petting a dog, sitting down, closing your eyes, meditating for 20 minutes, breath work is now big. Like none of these things are going to be recommended by my family doc, let alone, fuck like psychedelic therapy, like that. We're so far behind with that stuff. But like, it's just the experiences I have with the sort of, you could say the cookie cutter or go-to places for me to get help. I haven't gotten any help. My family doctor has anything useful to say to me. Right. But I found like Ayurveda, traditional Indian medicine, integrative medicine. This guy, Dr. Andrew Weil, one of the pioneers of integrative medicine, which I think is really good, kind of combining the best of Western science and Chinese medicine, Indian medicine, and kind of combining those two kind of synergistically. Obviously, the psychedelic therapy, that's kind of a new thing that's coming up more and more, mindfulness, and, obviously the Huberman Revolution, Peter Attia, all these new guys, like a lot of that is missing from kind of mainstream kind of standard medicine. So it's unfortunate that I have to say, for like a lot of people listening, at least in Canada, but you could expand that to wherever, that just a lot of, mainstream clinicians just are not going to recommend things that are best for your health, and might just give you a pharmaceutical medication for your anxiety, give you an SSRI for your depression, when you actually need psilocybin because you haven't worked through your trauma from your dad or something, or because, you need to actually take magnesium and ashwagandha for your anxiety, not these pills that are not actually going to, help you in a significant way. Or if they do, they're going to come with side effects and you might become dependent to them. Like there's all these issues, right? And I assume you share a lot of those concerns that I do.
Yeah. I mean, there's only a limited amount of time that family doctors have, right? So like for me, like most people don't ask me about those questions. They don't have the time, and like they're not in a position where they're even, where they maybe even could, afford to try some of those things, even like, magnesium, ashwagandha or anything like that. And they're really just trying to get out of like, from the bottom somewhere, so I don't have, too many people asking me those questions, but, when they do come up, like I am able to answer them. And, again, I'm not like trying to justify those doctors or anything like that, but they weren't trained in that stuff. So you're asking them things that they weren't
it's a
trained
systemic
in,
issue.
right?
Yeah.
And so like, and the only reason, and I'm not trained in it, I'm very, very curious about all this. So as someone asks me a question about, hormones or peptides or supplements or something like that, like I'm probably, going to know the answer. But, I've been really, really, working hard at that like my entire life to kind of keep up with most things. Right. And, a lot of docs are, not into that. And it's not part of, what
Their
they're
education.
supposed to be. Like you are kind of supposed to be able to go to school and, maybe keep up a little bit and be a good family doctor. It's not like, hey, now you got to, do 10 years of nutrition and, all these other things just to kind of keep up. So it is
Right.
tricky. And that's why I always say like, just try to take care of yourself. Like the things that you mentioned, you got to try to take care of those things yourself. If you have like, a really sore throat or, something like that, that's, an acute thing that's more serious, definitely your family doctor will be able to help you out, more then. But for the things that you're trying to look for to optimize, like I'm just saying, like, don't look that way and, don't think that you necessarily always need them to do those things for you because, you don't.
Yeah. I mean, they just lack the knowledge and education. I mean, I'm not just pinpointing individual doctors per se, although, I feel like everyone should take responsibility, even if you weren't educated as a doctor and, you've been practicing for many, many years. I feel like, being a responsible person who wants to care for your patients, maybe you should look into certain, herbal meditations or therapeutic compounds or, different.
It's hard though when guys are working like 50 or 60 hours a week, right?
I get it.
It's not possible. So like what I'm saying to you is like, it's not possible. It's not going to change. Like there's no way for it to change.
Unless the education changes.
Yeah, but there's just too much. You'd have to go to school for 25 years.
I feel like there already are some systems in place, like Dr. Andrew Wheeler, if you're familiar, and the whole field of integrative medicine, where you're trained to know a lot more about nutrition and mental health and different systems of herbal medicine, like traditional Chinese medicine and Ayurveda. So like there are other systems out there of medical education that I think are better. So I think it's definitely possible.
I wouldn't hold any hope. Like it's not going to come to the masses at all. It's going to be for like the top 1% and it's going to be super, super expensive. Like it's not going to come anytime soon.
Yeah. But we agree that we'd want it to come, right? I mean, you seem very cynical.
We want it to come, but it's not going to.
Yeah, well, yeah, and I agree. It's probably not going to. Anyway, I know you got to go. Mike, thanks so much for coming on. Really appreciate it. We'll do a part 2 soon, and we'll go more into specifics in terms of different things on diet, nutrition, health, and sleep. So look forward to do that, and we'll get more listener questions by then too. So yeah, thanks for coming on.